In this presentation, we're going to talk about the $2 trillion CARES Act related to the COVID-19 crisis. My name is Praveen Suthrum, and I'm the president and co-founder of NextServices. The only disclosure that I have is we do work with medical practices, particularly in gastroenterology and the ancillary market. Just a disclaimer, I'm not a lawyer or an accountant, even though I have an MBA from the University of Michigan. Use this presentation to understand what this act is about, but before making any business decisions, do consult with your lawyers or accountants. There are four main things that we're going to talk about over the next several minutes. One is the Small Business Paycheck Protection Program. That's a $349 billion program. Two is the Economic Injury Disaster Loan Program. That's a much smaller $10 billion program. And three, we're going to talk about the Public Health and Social Services Emergency Fund. That's a $100 billion program targeted at the healthcare industry. And then finally, we're going to talk about Medicare advance payments. It's something that you need to act on as soon as possible. All these programs are targeted at small businesses. The definition of small business is you have less than 500 employees. And the second criteria is that your business should have been impacted by the COVID-19. That I think pretty much would cover all of us at this point. So first thing, the Paycheck Protection Program, or PPP. It has a 4% interest rate, a 10-year term, 6 to 12 month loan deferment. So if you want to start paying it, you could do so after a 6-month period or a 12-month period. You can use the amount only for allowable expenses, and we're going to get into that in a few minutes. No fees, collaterals or guarantees needed. 100% loan forgiveness is possible. We're going to get into how that's going to be possible. There are no taxes on loans that get converted to a grant. The covered period is from February 15th to June 30th, 2020. First, how do you compute the maximum loan amount? Now, the maximum loan amount is equal to your average monthly payroll times 2.5. What they're trying to do essentially is give you 250% of what you're likely to spend in payroll in a month. And they're going to do that in advance as a loan so that you can get through this crisis. And how do you compute your average monthly payroll? By dividing the total payroll for the last 12 months by 12. There's a cap that you need to use for salaries that are over $100,000. Let's take two examples. The first example. So this is ABC Gastroenterology. They have 6 employees and they're all on W2. 2 physicians and 4 staff members. Both the physicians earn over $100,000. And let's look at individual annual compensation for these 6 employees, and it ranges from $50,000 to $150,000, $170,000. Now, if you remember, we got to cap the ones which are over $100,000. So employee number 5 and 6, we're going to cap that to 100 and then compute our total annual payroll. In this case, it is $480,000, and when I divide that by 12, I get $40,000, which becomes my average monthly payroll. And when I multiply $40,000 with 2.5, I arrive at $100,000. So $100,000 becomes the maximum loan amount that I can apply for. Let's take one more example now with a larger practice, XYZ Gastroenterology. Now this group has got 150 employees on W2. 20 of them are physicians, 5 are PAs, 125 staff members. 30 employees earn more than $100,000. 10 of the physicians are also earning via a partnership, maybe they're owners in the ambulatory surgery center. So how do we compute now the annual compensation? Again, I've taken averages, but how you must actually do is put all this in a spreadsheet and get the actual numbers. But let's go ahead with this example. So 60 employees are earning on an average of $50,000, 40 of them 70K, 25 of them 80K, 5 are earning $120,000 and 20 physicians are earning over $250,000. Again, this is an example. And so if I want to arrive on total annual compensation, I'm going to multiply 60 into 50K. That would get me to 3 million. So again, I want to remind you that you got to cap the ones which are over 100K. So I'm going to do that first. So when I do that, my total effective annual payroll in this example comes to $10,300,000. So what happens to the amount that physicians earn through partnership? My take is it doesn't matter because that would still take them over the 100,000 cap amount. So it really does not matter because they get capped at 100K anyways. And the way I compute the monthly payroll from that would be to divide that by 12. And in this example, I come up with a number 858,333. So let's just continue with that example. When I multiply the number, my monthly payroll number with 2.5, I arrive at $2.15 million, close to $2.15 million. And that becomes my maximum loan amount. So what are allowable expenses? So broadly, I would fit them into 4 categories. One is payroll, benefits, and healthcare, your group healthcare policy, that's a cost. 2 is any interest that you have on the mortgage, not the principal, but the interest on the mortgage. 3 is rent and utilities. And 4 is interest on any debt that you had before the crisis began. So how do you get full forgiveness of a loan that you take under this program? How does a loan become a grant? Now, ABC Gastroenterology has to spend all the $100,000. Like, so if it has taken 100K as a loan, it has to spend on qualified expenses or allowable expenses in 8 weeks starting from that start date of that loan. Similarly, XYZGI has to spend $2.15 million if that is the amount that they took in 8 weeks from the start date of their loan. Second point, you have to maintain the same headcount and the average monthly payroll as you had before the crisis began, or you got to get to that point before the covered period ends. In this case, it's June 30th. And another point is you cannot go about reducing employee wages by more than 25% for people who are making less than $100,000. And finally, once this becomes a grant, you don't have to pay tax on it. It's a very important point to remember. Now, what is partial forgiveness of a loan? Very simply put, if you don't meet all the criteria for full forgiveness, you would switch over to partial. Just at a high level, what I want you to understand is that whatever amount that can qualify as a grant starts getting prorated or gets penalized, and that depends on your ability to maintain an earlier headcount that you had, maintain your earlier payroll, spend all the money in 8 weeks, and spend the money on allowable expenses. So how do you apply for this program? You got to contact a lender. So these are banks. There are 1,800 banks that are part of this program, and SBA is likely to issue more details about this program in the coming days. There's also another important act that you should be aware of. This is the Families First Coronavirus Response Act. I'm just going to give you the high level details. It's effective from April 1st, 2020 all the way through the end of the year. It is important for you to be aware of this because it would help you decide how many employees to furlough if you're planning to go down that path, and who. There are several factors that might influence your decision. These may include optimal use of funds, the leave periods that somebody may go into, whether it's better for them to choose unemployment versus staying employed, and also understand that this determines the maximum loan amount that you qualify for. Let's get into the second part of the program that I wanted to tell you about, which is the Economic Injury Disaster Loan. So this is a $10 billion program. You can get up to $2 million in loan. The interest rate is 3.75%. The loan is for a 30-year period. Unlike the other one, there's no forgiveness program here. The way to apply is to go to the sba.gov website. You'll see a yellow bar right on top. You click that, and then there's an application process that you have to go through. Now, the third thing is the Public Health and Social Services Emergency Fund. So, what qualifies in this? This is completely focused on healthcare, as you can see. So, one are expenses directly related to COVID-19. This is any increase in staff or training that you had to incur, any equipment that you had to buy, building of structures that you've had to do, or maybe you might do in the future if the crisis gets out of hand. So those are expenses that are directly related to COVID-19. Now, there are also expenses that are attributed to COVID-19. It's because of the crisis. If you had to reschedule your procedures and you've foregone procedures, like so you have a loss in revenue and loss in your margins, you can get reimbursed for that. Who is eligible? There are several healthcare entities that are eligible, and it includes physician private practices and ambulatory surgery centers. Now, HHS will be paying this fund on a rolling basis. They're not going to do a bulk payment, so it's going to be in batches. They're yet to clarify on how you must apply or how they would reimburse. One thing to remember is that if you're getting reimbursed from another channel for a certain expense, you cannot apply it here. The most important thing that I want you to take away in this section is that you must keep track of any lost revenues or margins because of COVID-19. What could that mean? How many procedures did you have to cancel or reschedule, say starting February 15th, 2020? Or what is the delta of lost revenues during the period Feb 15th to June 30th? I'm taking the same covered period that applies to another portion of the Act, but then this can just help you get started and putting touches on thinking through on what you should be capturing. How many procedures were replaced by lower margin procedures? What kind of additional costs did you incur in training staff or adding staff? Finally, I want you to take away this from the Medicare advance payments. What Medicare has announced is that you can request up to 100% of Medicare payments for a 3-month period, all in advance, and they are expected to process those payments in about 7 days. There are plenty of references that are available out there, but I do recommend that you go through the original Act. It is available online, and you can actually jump to the portions that are of interest to you or that you would like to learn about, and it's fairly readable, even though the whole Act itself is 800 pages plus long. I want to leave you with some final words that I found in one of the articles. The advice was, file first before they say something different. Thank you so much for listening to this presentation. My team and I are here to help.